All right, hi there. This is Dr. Zach Watkins, and I want to share with you a video talking more about thyroid health because I know that's such a huge topic in today's society, especially with women. And what I think there's a big misconception that if we have a hypothyroidism or a sluggish thyroid, basically, that the thyroid is the main problem. Now, from a functional medicine perspective, when we look at the thyroid, we tend to say, now is the thyroid really the problem itself, or are there other contributing factors to it? And if so, what can we do to take care of those factors and to improve overall health or underlying health so that we can support proper thyroid function? So I've got a couple examples today. There's some recent labs that came through our office that really showed this example very well. And I wanted to share it with you. So again, I apologize if it's kind of technical. I don't mean to be too lecture, but I want to show show a real life example about kind of what functional medicine doctors, how they look at the thyroid and how they look at overall health in general. So one thing I wanted to show is there's a little picture that I put together a while ago. And it does talk about, this is the example I give. So read up here where it says, these are some of the mechanisms that can affect the thyroid negatively and or positively. And it goes beyond the TSH. So TSH is a marker that's typically looked at when someone's getting their thyroid levels checked, or not even their levels, just basically TSH, which actually is not even a thyroid hormone. It's made in the brain, and it tells the thyroid, what to do, either speed up or slow down. And the problem is there's so many things that can tell the thyroid to speed up or slow down. So that's why it says it goes beyond just this little marker that you see. And here's why I kind of put together. So you have the thyroid gland, and it's kind of just like a target, and you're getting hit at by many darts. So things that affect it are in things. The big things that we look at too are, hormone imbalances. If we have hormonal imbalances, that's going to negatively affect thyroid health, especially insulin or basically your blood sugar hormones, but also estrogen and testosterone, progesterone. Those kind of things are going to affect that as well. Environmental toxicities. We're not really too much of a stranger to how our society is full of these things. Like mercury is one of the largest ones. Plastics, things in plastic materials or in our water. We're getting more and more environmentally toxic, whether we like it or not. So this is negatively affecting our health, especially the thyroid gland. Medications can impact the thyroid, good or bad. The big one here, vitamin and mineral imbalances or deficiencies. So things like iron, we don't have to be iron anemic, but we could be iron deficient or low in iron. B6, B9, B12, vitamin A, selenium, iodine, minerals, things like that. Now these don't have to be severe deficiencies, but just insufficiencies are more like it. And these are things that we commonly and routinely look for because, like we say here, it's going to impact your health negatively, many areas, but especially the thyroid. Inflammation, huge. Inflammation is like a fire in the body. It burns nonstop unless you stop it, but you have to find where the fire is coming from. Now, I put cytokines here. Cytokines are basically, I call it like confetti in the blood. It's given off from a fire that is directing and telling the immune system what to do, and it's damaging to different areas of the body. And those can come from multiple things like food sensitivities, but also bacterial infections. That's what lipopolysaccharides mean. There's parts of the bacteria that we can harbor in our GI tract, but other areas that when are given off in the body or when are degraded, that can negatively again affect thyroid health. Liver detoxification. The word detox is kind of I don't like the word very much. It just doesn't sound great when you tell people they're going to do a detox. This isn't we think of cheap teas that you buy at the store that make you go to the bathroom a lot. But there's more to detoxification than that. There's how well the liver processes things, how well it takes a used up hormone and converts it to something that you can eliminate either through the bowels or through the kidneys. And not only that, but environmental toxicities or toxins and bacteria, byproducts, medications, alcohol, caffeine, those kind of things. So if we have impaired elimination or detoxification, that's going to affect our thyroid. Gastrointestinal problems, very big, very common, is going to affect the thyroid. And also we talk about immune system problems and or autoimmunity, which means basically the body is negatively, or it's attacking itself. It kind of confuses bad things with yourself and can attack it. So you have all these, and there's other ones too, but there's all these areas that when you look at the thyroid, you either just say right here, we have low thyroid functioning, so it must be just this little circle right here. Or do we step back and say, do we need to consider all of these other areas in someone's health to affect the thyroid? And this is what I tell clients or patients that we see in our office, because someone may come in and say, our thyroid, I've been diagnosed with hypothyroidism, Hashimoto's, which is autoimmunity, or things like that. What can we do naturally for my thyroid? And when I step back and explain that there's so many other areas that has probably negatively affected their health, one, but then two, the thyroid, sometimes it doesn't, we tend to focus on the thyroid so much that we forget that, maybe there are other areas that we need to look at. And from a functional medicine perspective, that's what we really, really want to get to the bottom of. Not just saying maybe we need to give you some nutrients for your thyroid or take a magic thyroid vitamin. The theory is all well and good, but usually does not work very well at all. So, go to an example here. We had a woman come in here recently, and that's not going to work. She came in, she's 34, and we know from the history basically that she struggles a lot with a lot of what's called adrenal fatigue. And if you're not familiar with adrenal fatigue, I'm sure if you Google it, you'll learn quite a bit quickly, or just view some of my other videos that talk about it. Now, it's not really a medical diagnosed thing. It's just more of a state. You're seeing a gland that makes a hormone that's responsible for so many things: immune system function, inflammatory control, blood sugar balance, the stress response, basically. So it's got a lot on its plate. And day to day, this changes for us. We have seasons in life that this can cause changes as well. So we know this is going on with her. She's commonly low blood pressure, gets kind of dizzy when standing up too fast, those kind of things. So we already know that presentation already. So we see here when we're looking at labs quickly, when I look at some of these things, especially anything in blue is usually medically out of range. So we see her being very low in protein. And that's important because you can't carry hormones, you can't carry things in or minerals and nutrients in the blood effectively. So we don't like to see that. And when we get to the thyroid, you see this is what's commonly looked at, TSH. 7. Medically, they want to see more around 3 or 4. It depends on the lab. I don't think there really is a consensus. But in the functional medicine world, we want to see around 3. So this is definitely high, which is technically called hypothyroidism. So we look at more labs regarding the thyroid here, which usually isn't done. But this T4 total, this T4 free, T3 free, and T3 total. Now that's looking at basically how much hormone the thyroid is making. And the T4 total looks very good. The T4 free, very low. T3 free, obviously very low. And then the total is on the low side as well. So basically the thyroid is going to make, in response to what the brain tells it to, T4 hormone. And in the body, it's going to convert T4 to T3, which is your money money hormone, the one you want for metabolism and things like that. But if you remember my other picture where we say that, you know, if someone has intestinal problems or the liver doesn't detoxify well, you can't convert. You can't make T3 from T4, so that's difficult. But in this woman, we see that we're not getting enough active thyroid hormone. That's basically what it's saying. So therefore, someone's going to be sluggish, weight changes, fatigue, metabolism slows. We looked at her antibodies for autoimmunity, and these are negative. But we looked at her anemia markers too. You can see that these are very poor as well. Very low blood cell count, very low hemoglobin, and iron levels, ferritin, very, very low as well. So what I didn't tell you is actually that this woman is pregnant, and what we see here is a good example not only for pregnancy but also for any woman in general, anybody in general, but we're using women for the example here. So being pregnant, there's a higher demand on the body physiologically, you know, for more nutrients to help to grow a healthy, happy baby, and that's great. The problem what we're seeing here is it's just depleting this woman of important nutrients. So think of if you've been pregnant or a friend's been pregnant, where after the baby is here, women are usually just depleted. They're tired, they're fatigued, their weight changes are significant. Hormones are not working adequately. You know, this is showing that the body, and by the way, a lot of these were normal before she was pregnant, and we see these things just drop dramatically. So high demand physiologically on the body, and that's what I tell women in this situation, that you're just not, we just don't give thyroid hormone and assume that's it. We're wondering why are these things going on. Well, there's a large physiological demand for her, which is a baby, just like another woman could have high physiological demand for something else. Let's say a major stress response like going to school again, or not controlling blood sugar. Those are high nutrient demands that cause a lot of these shifts. Hopefully that makes sense. You can see that we're not looking at them as a disease now, but what's causing these higher demands? What's causing these nutrient depletions? And that's important. So we use some nutrients related a little bit to the thyroid, and kind of started pretty slow. And I want to see how she did in a few weeks. So when we look at it, this wasn't fasting, by the way, so I'm not worried about that. We see almost things look a little bit worse, some things. And this is to be expected. This is commonly seen. And I tell people it's common to get worse before you get better. It's like riding the wave of an ocean. You're going to go up and down and up and down. So we see here a higher calcium need, which is dropping. And that's common because her protein levels are low. You see the TSH, the thyroid hormone, is actually even higher, meaning it's even slower than it was before. Now, those of you who have hypothyroidism are probably familiar with this. When their TSH, this is what's monitored if you're using medications. So we look at the thyroid hormones. What are they doing? Still not converting to the good active metabolism money hormone, T3, the free one. Now the T3 total is increasing a little bit, so that's nice to see. And the anemia markers don't change much quickly because it takes about 3 months to see decent improvements in those, because that's when the blood cells replace itself. And let's see, finally ferritin, and that's coming up, at least we're out of the basement here, the gutter. So still very low, but better than a 7. So sitting back from a functional medicine perspective, I'd say, okay, we still know the thyroid's involved. We still know there's a high demand for nutrients. What do we need to do? And we know that there's a lot of impact of the adrenal glands or cortisol with thyroid. So we decided that we needed to really work a lot more focused on the adrenal glands, kind of to say, you know, the thyroid just kind of, it's like we're kicking a can. It's not going very far. We need to bring in a guy with a really good leg to kick it further. It's kind of a horrible example, but so the adrenal glands usually get pretty sluggish, and they get sluggish because of these nutrient demands. All of that slows the thyroid. So we decided we need to do things to increase the demand of the thyroid. increase the demand of the adrenal glands, increase the ability of the adrenal glands to be balanced. This comes from nutrients, but also we need to control blood sugar, we need to sleep well, we need to manage stress. All these things support adrenal health, which therefore support thyroid health. So let's go to, I might leave this up a little bit. Let's go to the third one. So we utilize some nutrients that I really like in our office that kind of kicks the thyroid in gear a little bit, but also the adrenal glands. We kind of decided, let's put this to the test and really try to support the adrenal function and the thyroid function to really make it kick in gear better. So we see protein levels increasing. That's good. Calcium levels are normalizing a little bit. Here's the most significant one, if you can see here, is the TSH, which is the thyroid hormone. Over here we see it was 9.5, very hypothyroid. Typically medically they say that's not going to change probably for a while, so you're going to have to just monitor your meds. But we see here in a couple of weeks her TSH dropped down to a 1. And that's pretty dramatic, especially using nutritional things. As well, the T4, sorry if you can follow my arrow here, is increased from last time. The free T4 has been increased. The T3, which I was worried about, jumped up quite a bit to a really nice level. And the T3 total started out at 104, and now we're creeping up to 150. That tells me that in a short way, basically, this is telling me that we are controlling the adrenal glands quite well, because cortisol has a lot to do with this T3 total right here. So the more it increases, the better it tells us about the adrenal glands. You can see her anemia markers are all within normal range. Medically, mind you, I still think these are very low. But we're out of, again, the proverbial basement, which is important. And then ferritin, storage level of iron. Way back when we started about 8, and now we're at 26, so we're getting there. So this is good for me because this woman is not only continuing to support a healthy baby, but it's going to support her post-pregnancy to have the nutrients that are allowing her to continue healthy functioning versus just dropping off a cliff, if you want to put it like that, actually. So, I bring this lab up. Again, it's very, if there's some clinicians watching as well, this may make some more sense and if you're geeky like me, this is more fun to look at. And I don't do this to bore others, but I wanted to show how those of you especially who get their TSH tested a lot, we see that there's some significant hypothyroidism. We're using meds to control it or to give you more thyroid hormone, when in actuality, in most cases, especially this woman, it wasn't necessarily the thyroid, it's more the adrenal function that's really suffering. So we saw some very good things. We see the thyroid hormone converting properly, if you remember me saying that. And this was all based off of looking at this person from a functional perspective, not necessarily just medical, and saying, well, you have hypothyroidism, woe is you, here's some medications, and then go through pregnancy, and after pregnancy being a woman who's probably very depleted, which is what we commonly see. Women after pregnancy very depleted, very tired, weight changes, depressed, and possibly autoimmunity. So the way to get ahead of that is to say, do we have a thyroid issue or are there other issues involved? That's what functional medicine does. That's what we do. That's what I do. That's what my passion is. So I wanted to show you that to say I was very happy to see this kind of response, to know that, we are doing the right thing, and nutritionally you can do a lot for yourself to prevent further disease or disease at all. But, living for longevity, and that's the key. So I really appreciate you and your time and your ability and desire to learn more. I can respect that because that's my game too. I love to learn more. If we're not learning, we're just living life and growing old, right? So I appreciate the time, and if there's ever any questions, please contact our office or post them to our Facebook site, and we check that off and on to hopefully respond some, but feel free to contact our office and if there's questions related to that as well. So please be well, and thank you for your time.